Hello, my name is Raj Narayanan. I'm an interventional radiologist at the Miami Cardiac and Vascular Institute and the Chief of Interventional Oncology for Miami Cancer Institute. Both of these are part of the Baptist Health South Florida. Microwave ablations has been a mainstay part of most interventional oncology practices, both in the US, Europe, and many parts of the world. But most recently at ASCO and currently in the Lancet Oncology Journal, we had the results of the collision trial that was presented and published. So the collision trial is a randomized controlled trial which was conducted in Amsterdam and was spearheaded by Professor Martijn Meijering. And this study was done to compare microwave ablation to patients who had resection for colorectal liver metastases. And the study showed that ablations were non-inferior to surgical resection. But more importantly, they had the durability of the outcomes and also shorter hospital stays for patients who underwent ablations. Having a level one evidence like the collision trial, I think was going to go a long way in establishing microwave ablation as an important player in the management of patients with colorectal liver metastases in ideally selected patients where it has been shown to be as good as surgical resection. Clearly, this level one evidence is already having an impact on the ablation world. Right in our practice itself, we have seen our surgical and medical oncology colleagues embrace the outcomes. Thermal ablation, especially microwave, is integral part of our ablation program. It's pretty much the workhorse of all the ablation procedures that we do. So we use it predominantly in the liver and in some selected cases of lung and kidney, but mostly in the liver for treatment of HCC and metastatic colorectal cancer. We feel that it offers a great option. So starting in early 2024, we started the first robotic ablation program in the United States using the Epion robotic system, and part of that package was a planning software which allows you to both plan and also assess the ablation margins. So we've been using that since then. It has definitely changed the way we look at ablation confirmation. In the past, we would rely on contrast enhancement or lack of enhancement after the ablation and try to just use measurements to see whether we created an adequate margin. But now with the planning software, we are able to do a volumetric assessment of the tumor prior to the ablation and do post-ablation volume and create an overlay between the two, which gives us a more visual representation of whether we created an adequate margin or not. And if we need to make any adjustments, we can do that right away rather than having to wait for the first follow-up. So we started using the IntelliBlate system about 2 to 3 months ago. I'm not sure of the exact date, but so far we've done about 6 patients with that, and we have a few more that have been planned. So my early impressions about the IntelliBlate is that it is a well thought out, planned, and executed product. A lot of the way the product has been designed and brought to clinical practice shows that there's a lot of thought that has gone into it, starting from the footprint of the device, which is pretty compact, but adding a touchscreen that gives us real-time assessment of the ablation zone and temperature readings. And in addition to that, the way the cord of the ablation probe has been designed is also seems to be pretty well thought out and executed. It has been pretty easy to set up and use. And more than that, the results so far have been pretty reliable. What we thought we were going to get is what we got after we completed the ablation. Those of you who've been using microwave since its inception know that reliability used to be a problem with microwave ablations in the past, where we would not be able to predict exactly, what the ablation zone might be. But that problem has been mostly one of the past with the newer devices, and I feel in this particular device you're able to get the ablation zones that we plan. The results so far have been early results have been good. Most of the patients who have been treated with IntelliBlate have had at least one follow-up, and so far we have not seen any local recurrence of the tumor in the ablated zones. So overall, we're pretty happy. The other additional feature which I liked with the device was the ability to use two probes, which we did in one particular case. So we are able to do place two microwave probes and get simultaneous burns, which gave us a bigger zone than what we would have gotten with one using one probe, which I think would be very helpful when we are now expanding ablations to bigger tumors. To come up with a device that addresses some of the limitations or problems that we've had with microwave in the past and execute it to the way the IntelliBlade has been is a welcome addition to the microwave space. So it offers for the clinicians easy to use and a reliable device with additions in software, which typically we've not had with most devices in the past, and also to be able to use more than one probe to perform simultaneous burns. All of these, I feel, are an advantage for clinicians. From a patient standpoint, to be treated with a device that provides reliable outcomes, I think is important without having the limitations that microwave technologies have had in the past. Currently, we are the early stages of using this device. So basically, we are learning and using it. And so far, we've been happy with it. How do we see it changing our ablation practice? Depending on the outcomes that we continue to see, we probably will continue to use it more. Changes which we will be looking for or enhancing the device is also combining it with our robotic ablation program, where we've now switched to almost every ablation that we do in our practices is with robotic guidance. So that'll be something we'll see how the IntelliBlade performs with robotic guidance. So far, it has worked really well, but the more patients you treat, the more your experience is enhanced. So those are the areas we're seeing, and also would like to see how the IntelliBlade software itself is plays a role in assessment of ablation success. So we believe in collecting our data and analyzing it and seeing how it actually pans out. And so we're looking forward to seeing how our data looks a year from now and hope to publish on that.